You know, when we think about surgery, our minds almost always jump straight to the operating room. But the real danger? That can often begin after the patient is wheeled into recovery. Today, we're going to explore what happens when that post-operative safety net fails, which is a critical and often unseen issue known as post-op negligence.
So here's our roadmap. We're going to break this down into 5 parts. First, we'll talk about that super important recovery window. Then we'll look at what happens when that vigilance fails and, well, the pretty devastating consequences that can follow. Finally, we'll switch gears to the legal side of things, defining the standard of care and walking you through how exactly negligence is proven.
All right, let's kick things off with that crucial period right after surgery, the critical recovery window. This is when a patient is at their most vulnerable and the need for careful, constant observation is at an absolute peak.
Just because the operation is over doesn't mean the danger is, not by a long shot. After any surgery, the body is under an immense amount of stress. It's not just healing from the procedure itself, it's also recovering from the anesthesia. This creates, frankly, a high-risk environment for some major complications, things like internal bleeding, serious infections, or even respiratory failure.
To manage this risk, the patient's care team has a duty to be incredibly meticulous. And that means a few key things. We're talking continuous monitoring of vitals like blood pressure, assessing neurological status for any little change, carefully managing pain medication, and of course, constantly observing the surgical site for any sign of trouble.
So what happens when that meticulous, around-the-clock vigilance just fails? This brings us to a very specific type of medical error, and it's called failure to monitor.
Now, in legal terms, failure to monitor isn't just a simple mistake or an oversight. It's a breach of the medical standard of care. The key words on this slide are reasonably prudent provider. The law isn't asking for perfection. What it's asking is, what would another competent professional have done in the exact same situation? It's a standard of competence, not of being a superhero.
Which of course leads to the big question. How does something like this actually happen in a modern busy hospital?
Well, monitoring can fail in a bunch of ways. It could be something like inadequate checks, where staff just aren't looking at the vital signs often enough. It could be ignoring what the patient themselves are saying, their own complaints. Sometimes it's just plain poor communication, where critical info doesn't get passed from one shift to the next. And other times you're looking at bigger, systemic problems like understaffing or even technical stuff like ignoring the alarms on the equipment.
And when these failures do happen, well, the consequences can be absolutely devastating. Let's really look at what's at stake here.
Okay, first up, internal bleeding, or hemorrhage. There are very clear warning signs for this, like a sudden drop in blood pressure and a heart rate that spikes. Vigilant monitoring is designed specifically to catch this immediately, because without a quick intervention, it can turn fatal fast.
Next, there's sepsis. Sepsis is the body's overwhelming and, frankly, life-threatening response to an infection. If a surgical site infection isn't caught through regular, careful observation, it can spiral into sepsis, which often leads to organ failure. Then you have the risk of a pulmonary embolism. This often starts out as a simple blood clot in a deep vein, which you can usually detect by looking for swelling or listening to a patient's pain. But if that monitoring doesn't happen and the clot breaks free and travels to the lungs, it becomes a sudden, dire medical emergency.
And finally, respiratory distress. You know, patients can have a tough time breathing because of the anesthesia or certain pain meds. Without proper monitoring of their oxygen levels and how fast they're breathing, this can lead to respiratory arrest and, tragically, permanent brain damage.
So, now that we've seen the devastating consequences, let's pivot to the legal framework that's designed to prevent them. This whole thing is centered on one crucial concept, the standard of care.
Right, so like we touched on earlier, this is the legal benchmark. It's not about asking if the doctor could have done something perfectly. The real question is, did they act the way a reasonably prudent and competent professional would have acted in that exact same situation? That is the line that separates an unfortunate but unavoidable outcome from actual negligence.
So how is that standard actually figured out in a legal case? Well, courts typically look at 3 main things. What are the accepted prevailing practices in the wider medical community? What do the hospital's own written policies say? And finally, they rely on testimony from other medical experts who can explain what a competent provider should have done.
And that brings us to our final section, actually proving medical negligence. So what are the 4 key elements that have to be proven for a legal claim to even have a chance of succeeding?
Here they are, and you have to prove all 4.
First, that a duty of care existed between the provider and the patient. Second, that this duty was breached. Third, that the breach directly caused the injury, that's called causation. And finally, that the patient suffered actual damages.
Now this is where it gets really interesting, because we can break it down with simple examples. Duty of care, that's easy. It's just the established doctor-patient relationship. A breach of duty could be, say, a failure to check vital signs as required by hospital policy. Causation is the critical link. You have to prove that because the vitals weren't checked, treatment was delayed, which resulted in brain damage. And finally, damages. Those are the quantifiable harms. The extra medical bills, the lost wages, all of that.
And so that brings us right back to the central question, doesn't it? What is that fine line between an unavoidable complication and actual preventable negligence? Look, this isn't about demanding perfection from our doctors and nurses. It's about upholding the standard of care that every single patient deserves. And understanding that distinction, well, that's the most powerful first step there is.